In today's lesson, we're going to learn about coronary heart disease, which is also called coronary artery disease. So, coronary heart disease, or CHD, results from a narrowing of the small blood vessels that supply blood and oxygen to the heart. So, those being the coronary arteries. And coronary heart disease is usually caused by a condition called atherosclerosis. So, what is atherosclerosis? So, it's a disease in which plaque builds up on the inside of your arteries. So, normally you want your artery walls to be nice and smooth, your artery to not have any obstructions so that blood can flow easily through it. But when you have atherosclerosis, you get a buildup inside the artery so that the flow is restricted and the artery could become blocked by a blood clot if one happened to form. So, the steps of atherosclerosis formation. So, the first thing that has to happen is there's some sort of damage to the inner lining of the artery. And this causes phagocytes, which are part of your immune system, to be attracted to that area as they sense that there's damage and they'll want to repair it. So, when they get there, they release growth factors, and this stimulates the muscle and fibrous tissue in the artery wall to thicken, which is not really what you want to happen. So then LDL may penetrate the damaged area and release cholesterol, which can build up to form large deposits. So LDL stands for low density lipoprotein. And so cholesterol is carried around the bloodstream by these lipoproteins. And LDL is the one that's known as the bad cholesterol. So when you have high levels of cholesterol, which we know is not a good thing, this is one of the reasons because it can build up and form large deposits. The growth of the wall tissue and the accumulation of cholesterol causes the artery wall to bulge inwards, which reduces or even prevents the flow of blood. The thickened wall loses its elasticity, and calcium salts are sometimes deposited in it, making it hard. So the artery hardens and it's just not working the way it's supposed to. The rough inner surface of these atherosclerotic arteries tends to damage platelets as they flow by. And when a platelet gets damaged, we know that that starts the clotting cascade. So, this will cause a blood clot to form. And so, the formation of clots is called thrombosis. If a clot is formed and then it blocks a coronary artery, part of the wall of the heart will be deprived of oxygen. And as a result, that part of the heart will be unable to contract. And this is what is a heart attack, otherwise known as a myocardial infarction. So, a heart attack is when part of the heart is deprived of oxygen and can't contract. If the clot instead heads to the brain and blocks a vessel there and causes a portion of the brain to be starved of oxygen, this is called a stroke. Okay, so a stroke and a heart attack actually have sort of the same cause behind them. It's just where they occur that makes the name. So, heart attack, the clot is in the heart, and stroke, the clot is in the brain. So, finally, what are the risk factors for developing coronary heart disease? So, the following factors increase the risk. So, as you get older, the risk increases. If you are male rather than female, you have a higher risk of developing coronary heart disease. If you have a family history of CHD, if you are overweight or obese, it increases the risk of coronary heart disease. If you have low levels of physical activity, that increases the risk. High blood pressure, smoking, and a diet high in trans fat, saturated fat, or cholesterol. Okay, so all those factors can increase the risk that you're going to develop coronary heart disease. Okay, so that's our little overview of coronary heart disease.